Welcome to today's ATA webinar presentation. Shh! Don't say that. Ethical Dilemmas for Interpreters in Healthcare. I mean, don't you just love the title, guys? Anyway, thank you all for attending. Just a few notes before we start. It's a 60-minute presentation. If we go over, feel free to leave at the end of that time. ATA certified translators who stay for the full 60 minutes will earn 1 hour of continuing education credit for their participation. The confirmation email you received at the time of payment is going to serve as your certificate of attendance should you be audited. The webinar is being recorded. A link to the recording will be emailed to all attendees following the live event, so you can listen again and take notes later. That sort of relieves some of the stress of taking notes during the webinar. And the recording will also be available on demand from the ATA website. So if you find it useful, I hope you'll recommend it to some of your colleagues. All attendees are muted for today's webinar. This is one of the big questions we get. But we do want you to participate, so take a minute right now to look for the question box on your screen. During the webinar, you type your questions in this box, and we plan to have a question-answer session at the end of the webinar. Now, more than likely, there won't be time to answer all the questions, but we'll get to as many as we have time for. And there's a real treat with today's webinar. 7 handouts. You can find these on the ATA website, www.atanet.org/webinars, and I'm also going to broadcast those links to you through the chat box. And with that, I'd like to turn today's webinar over to the presenter, Elena Langdon-Fortier.
Thank you, Mary. And I would like to start off by thanking the ATA for inviting me to present today, and also the Interpreters Division, which was instrumental in having me here today, Telma Ferry and others at the Interpreters Division, and of course the people that are helping organize and keep me on track, Mary David, Lucy Brooks, and Naomi Sutcliffe-Gimorais. It's a pleasure to be here today to present about ethical dilemmas for interpreters in healthcare. I will refer at times to interpreters as medical interpreters or healthcare interpreters, and I consider it to be the same thing. This issue, as many issues, is up to some debate for some people, but for today's presentation, it's really considered the same thing. In terms of the outline of what we'll be looking at today, we're going to look at why ethical dilemmas, why even talk about this. We're going to look at the role of professional associations for medical interpreters. We're going to look at the commonly defined roles for a medical interpreter today, the standards of practice and the codes of ethics of the different professional associations that we have. And throughout the presentation, we're going to be going over some case scenarios. I will work through 2 of them with you. I'm going to work with them in different ways. And the third one, we are actually going to get feedback from the audience so that you can give us your choice of what you would do if you were in that situation. And that will be based on a model of ethical decision-making process that I'll discuss. And probably a lot of you have noticed from my bio that I do, as many people in the profession, wear several different hats. Please forgive me for the bad clip art illustration. One of these days I want to take a picture of myself with many hats on, but for now this is what I have. And so right now I'm in the role as a supervisor of interpreters and translators, and I also work as an interpreter in the hospital. This whole month our regular interpreter is actually on vacation, so I'm actually interpreting much more often than I usually get to. And I'm also a trainer of interpreters and translators. And so I'm giving this presentation really with that perspective in mind. And I would like to know from you what role you play in the world. So now we're going to run a poll to see, of those of you in the audience, what your role is, whether you're an interpreter, and you can pick multiple answers on this, because a lot of us are interpreters, trainers, managers. LSP, if you don't know what it is, you're probably not one, but it's language service provider. So somebody that works with an agency provides interpreters for others.
Okay, we'll give you about 15, 20 more seconds to vote. Nearly everyone has, actually. And then I'll read out the results.
Okay.
Okay, another 5 seconds. 4, 3, 2. If you haven't voted yet, now's the time. Okay, I'm going to close now and give you the results, which are that the vast majority of people here, 88% are interpreters, 33% trainers, 33% managers and supervisors, 16% LSPs, and 28% other.
Okay. Well, that's an interesting number for other. Obviously, I didn't think of all the options. Maybe we have some translators. Sometimes we have regulators, or we might have people that are actually not medical interpreters right now, and maybe they're thinking about a new specialization. So thank you for that. I gotta keep my clicking in the right place. So why ethical dilemmas? I mean, isn't interpreting really just about words, right? The person says you're going in for an endoscopy. You said, você vai fazer uma endoscopia, if you were interpreting for Portuguese. Is that really what's going on? For some reason, there was a double click here. Or is there more? If you see here, already it's brought up the second question, which is, okay, my slides are going crazy on me, excuse me, which is the second question, which is, endoscopy, most medical interpreters that are going in trained should know that. Herpactic whitlow is something that came up the other day for me, and I had no clue what that was and had to go looking. Now, I had time. I was actually not interpreting, and to tell you the truth, this was a written source. So if I were a translator, I would have time, and I would also find out that there's actually a typo in there. It's not herpactic, it's herpetic. But it's one of those words that for Portuguese, for example, whitlow has, it's not derived from Latin, and you can't add an O or an A at the end and know what you're doing. Interpreters don't have that time. So really, it's not as simple as doing the words, because in this case, if you're an interpreter and you don't know that word, you have to make that decision of what you do with it. So do you explain it? Do you, ask for an explanation and then explain it? Do you guess at it? Do you shove it under the rug and don't interpret it? Those are really the simple and basic ethical decisions that one might make about interpreting. There's more involved with that in terms of continuously doing research and maintaining glossaries, maintaining the terminology so that you're keeping up to date with slang, with new terms that are coming out. Those are kind of some of the basic decisions, but they are a matter of ethics. From really the basic idea of why I talk about ethical dilemmas is that really, as human beings, as social human beings, we are constantly confronted with things about which we have to make a decision and make a choice. And most of us are ethical beings. In other words, we make that choice based on a principle and based on something that's consistent. And one example that came up for me recently, for example, not related to interpreting, was here at my job at the hospital, we have some days where you can wear jeans, denim days. So those of us that work in offices with pretty tight dress codes, very happy that some days we can dress down a little bit. But it's a charity event, so you have to pay $3, and that money goes to a charity, goes to United Way. And you wear the sticker, and then you can wear the jeans. And so I came in the other day in my jeans on denim day, and came in the morning, and okay, I have to go buy my sticker. Well, something came up. I didn't buy my sticker. And then at lunchtime, oh, I have to go buy my sticker. Something else came up. I didn't go buy my sticker. And then at the end of the day, I realized that I had not bought the sticker. So to me, that's an ethical dilemma, because I could have just not bought the sticker. Nobody had noticed. My manager didn't ask me why I wasn't wearing the sticker if I was wearing jeans, and I could have just said, well, I'm not going to spend that money. And I came up with a solution, which was next time, which is a week from now today, when it's denim day again, I will buy 2 stickers, and therefore I will give my money twice, and to me, that would be the ethical choice. I'm still giving money to the charity. It's going to be a little bit late, but that's probably not very important. And I'm not really getting by with wearing my jeans but not paying for it. So really, to me, ethics permeates all aspects of life, and that's one of the reasons to talk about it, because they're not always that simple. And they also take a lot of pre-work. So you really have to do the work ahead of time to know what your principles are to begin with and how you're going to behave ethically when confronted with a problem. Because of course you're not going to have the answers to every problem in front of you, and you have to work them out. But if you already know what your own values are and how you're going to follow them, and then what others say about that, and that's what we're going to talk about in terms of professional associations, then you're already doing a lot of the work ahead of time. So when you have a minute to make a decision, you can hopefully do one that you can live with afterwards. A second reason, of course, I already touched on, is that it's not just words that we're interpreting. It's meaning. And when we talk about meaning, it gets a little more complicated. One of the reasons is this, because you don't always know the meaning from the beginning. So if you don't understand the meaning, how can you transfer that meaning into another language? But also because there's a lot more going on than just transferring the meaning. And when we're dealing with different cultures and a very different background and context of a patient who's LEP, who's limited English proficient, excuse me, which is the going term usually for medical interpreters. Instead of saying non-English speaking, we say limited English proficient, because they might actually have some English. I interpreted the other day for somebody who the whole encounter was actually in English, except for a few things that she would ask me, which I rarely do, but she was actually doing quite fine and has been doing this for a long time. Usually it's, they can say some things but not all of it, and they want the medical things to be interpreted. And so we talk about LEPs. And a lot of their context is very different from the doctors. It's a very different reality. And so the interpreter is really not just looking at words, just hearing words and conveying them in another language. It's not an instant process. There's a lot of complicating factors there. And that's what we're here to do today, is really look at that. What are these complicating factors, and how can we work through them to make good ethical decisions when we're confronted with a problem on the job. I did a survey, a very short survey. I didn't have a lot of time with on a couple of different listservs of medical and healthcare interpreters. And so this is by no means a valid survey, and for that very reason I'm not really going to give you percentages on much of it, but I wanted to see what professionals out there were thinking about ethical dilemmas. And I had in the few days that I ran the poll, I had 47 people answer it. And the percentages were very similar to the percentage of people that are here today, and a lot of overlapping roles. I had more than 100% in terms of interpreters and trainers and managers. So I also asked in that poll, how would they define an ethical dilemma? And so here's one of the answers, which is very basic, something you have doubts about. Here's another answer, which is a situation in which there may be more than one option to make a decision, and the options are not always black and white. Okay, so we're getting a little better idea of what the complication and the complexity is with that answer. And then the third one, which is even more comprehensive, in that any situation that may arise in which the interpreter is caught between two principles of the National Code of Ethics, making it seem impossible to honor both. So all of these, I think, get at it. The last one talks very specifically about what we're doing here today. Really looking at when there are, when there is no black and white answer in the National Code of Ethics or the National Standards of Practice. And most of my answers were some version of this, so I thought it was very interesting to include some of those for you to see. For the third reason, in terms of why ethical dilemmas are going back to what are the complexities, we have to go back in time a little bit. Actually, almost 500 years. I think it'll be 500 years if people are really right, which they might not be. When a woman who was known, or is known today as La Malinche, became a slave for Hernan Cortés in what is now Mexico as part of the conquest, as part of the the New World discovery. This is a very controversial figure. Some of you may have heard about her before. There have been books written about her, novels, and also academic works about La Malinche, who, I'm not sure if you can see my pointer, but it's this woman here in the middle. And she was captured. She, along with another 19 people, she was captured, and she quickly became an interpreter for Hernan Cortés. And she also became his mistress, according to the history that we have. She also bore the first recorded mestizo child, so he impregnated her, she became pregnant, and had a child who was, one of the more known mestizos of that period. And it was in 1512 that she was captured. So I thought that was an interesting. It's been almost 500 years. Anyway, she's a very controversial figure in the profession. For various reasons. I mean, she was part of one community. She was taken from there by force. She was working with somebody that was coming in, invading the natives. I'm simplifying all of this, of course. And she was then negotiating with her own community, but also with a lot of other local communities, so to speak, with the natives, and which resulted in the conquest of Mexico. So she's hated by a lot, and apparently there are not very many statues or anything honoring her in Mexico. She was later baptized as a Christian under the name Mariana, and she actually then married another Spaniard because Hernan Cortés was already married. So once he went back to Spain, she went with him, but then she married another Spaniard. And I think this gets at a lot of the complexity, because when we look at this image, there's, what do we think of immediately? I think one of the first things I think of is betrayal. Here in the United States, we have the figure of Pocahontas, which is not nearly as directly connected, but it's this idea of the two worlds coming together, and what is the role of that person? Was she betraying her people by doing this job, and by interpreting what Hernan Cortés was trying to do and negotiating with them and allowing for them to conquer the land and the people and end up really decimating a whole population. Of course, culture comes into it, because think of the differences. Look at the way they're dressed, the way even, here we have the hand gestures, which often are the very thing that also needs interpretation, not just words. I think of power. That's a really big thing in interpreting and translation studies. Is what are the power dynamics and the relationships between them? Who has the power? She was a slave. Nobody was paying her. It wasn't her choice, and she was his, quote-unquote mistress, which we don't know what that was either, if that was a choice that she made. And think of the natives and what power they had in the face of this force that was coming at them. Dialects. She actually participated in relay interpreting because she was not proficient in all the different native languages, and she also wasn't, in the beginning, obviously didn't speak Spanish. So in the beginning, she worked with another interpreter or another person that worked with Hernan Cortés, and would relay in another native language to him, and he would convert that to Spanish. And then she of course learned Spanish in time, and many other dialects that were in the area. And finally, technique. This, to me, this brings up, was she doing consecutive? Was she doing simultaneous? What was she doing? Was she using the first person? Was she summarizing? All of these things that we learn. So this is going back a long time, and she might not be very well respected by a lot of people, but I think she's a really important figure to keep in mind, especially as a metaphor. I think it's a really strong metaphor to keep La Malinche in mind. The other thing with that is she was alone. So she didn't have a professional association or 3 or 4 or 5 around her. She didn't have an employer. She did have somebody to answer to. She was probably one of the first to do it among her. She didn't have a standards of practice to look at, code of ethics, anything like that. Thankfully, we are not in that position, and thankfully we are hopefully not going through nearly as many rule boundaries issues as La Malinche was. So hopefully we are not interpreting in this type of situation. We are all paid for our work, unless we're volunteering for the Red Cross or something like that. And it's a choice that we're making, and we are all trained, etc., so that we have good technique. So this is kind of the basics, I think, of what our standards of practice became. When we talk about ethical dilemmas and we talk about where we are as professionals, there's a lot of things intersecting and going on and interplaying. So we have, of course, ourselves, we have the profession and the regulations that go along with that. We have our employer, which for some of us who are freelancers, that's a little ill-defined and it's a little complicated. You know, if we work for an agency, we do have to abide by their rules and regulations, but then we often don't have to or are not familiar with the rules and the regulations of a hospital or an agency. And then I think really above all, at least most of the time, is the law. And laws, regulations, any kind of rules. If you're medical interpreters, you're all familiar with HIPAA, privacy laws, and anything that would mandate that you do something. The very act of having medical interpreters in most situations is mandated by law. There are situations, and some of the case scenarios that we're going to look at, they're actually not mandated by law. Which is one of the reasons I chose them, because it's an interesting matter. But for the most part, an interpreter really has to look at all of these things and how do they relate to each other and what am I going to do according to them. And sometimes you might have to choose one over the other. So these are the three main professional associations that I'm going to talk about today. The main reason I chose these three is because there were two surveys done in the last couple of years which had 1,500 and another one had 2,200 respondents. These were surveys that related to certification of medical interpreters. And so that's a really big response pool, a lot of people. And these are the three associations that were the most mentioned in terms of what association do you belong to and follow in terms of the standards of practice. That's really the reason. We have the National Council on Interpreting in Healthcare. We have the International Medical Interpreters Association, which used to be the Massachusetts Medical Interpreters Association, and out of that grew the International Association. And we have the California Healthcare Interpreting Association. There are other regional healthcare medical interpreting associations, but those three seem to be the most influential in terms of what they're doing for setting standards of practice and codes of ethics. So that's why. These were some other associations that were mentioned in that survey that I did. So some of them not even related to medical interpreting. So NAJIT is the National Association of Judiciary Interpreters and Translators, American Medical Association, and then we had the one for ASL interpreters, Registry of Interpreters of the Deaf. Ming is one, I believe, in Georgia. I think it's Network. Oh, that is Medical Interpreters Network of Georgia, I believe. And then people mentioned their place of employment, state, national, Department of Health and Human Services, and the Department of Public Health. Going back a little bit to this idea that I mentioned below, beforehand, what are we talking about here? Again, sounds simple, not so simple. And even the word that is conjured up from this, which is accuracy, seems simple, but it really isn't. And if you stop to think about what it means to be accurate, there's a whole notion of, we used to call it fidelity, faithfulness. It was linked up with the Bible and the translation of the Bible, being faithful, had religious connotations. Now we have accuracy, but even that is not that simple. So I want to look at what those three associations say about accuracy. The California Healthcare Interpreters Association says interpreters transmit the content, the spirit, and the cultural context of the original message into the target language so that people can communicate effectively. So, we see the cultural context. The National Council on Interpreting in Healthcare, also very similar, strives to render the message accurately, conveying the content and the spirit, taking into consideration its cultural context. So again, culture. As we know, culture is not a simple thing. And the IMIA has, I took it from two different parts because the way the standards of practice are laid out, they're a little bit different. They don't name them quite the same. But we have one part that mentions transmitting the message accurately, re-expressing the information in its equivalent so that it elicits the same response as the original. This is very commonly done with translation as well, especially in the past, this idea that it should have the same response as the original. So, is endoscopy endoscopia? Because what if the patient doesn't know what an endoscopia is? I've had an interpreter argue with me that she shouldn't say endoscopia, she should explain that it's a little tube that they're going to stick down your throat and they're going to examine it. Which one is going to get the same response, and what is the interpreter's responsibility in terms of making sure that the response is the same? And then the other entry here, taking into account the context, the content, the function, the affect, and the register of the original message. That's probably a typo, meaning effect, not affect. So a lot of things going into just accuracy, which is one of many of the standards and the ethical principles mentioned by the associations. So I wanted to go over a case scenario and work that out a little bit given what we've talked about so far. This is a case scenario that has a lot of cultural components in it. We have a pregnant woman who only speaks Mandarin, Chinese. She's married to a man who only speaks English and Arabic. So right there, think what that means. Neither of them speak the same language. They're married to each other. She's pregnant with twins, and she's receiving prenatal care, so she's considered high risk because twins are usually just automatically considered high risk. She's got appointments at least every week throughout her pregnancy. Throughout her pregnancy, the husband is insisting that he be the interpreter. He doesn't want anybody else there. He wants to be the interpreter taking care of this. He does the same during her labor, and he does the same when it goes into a C-section. In fact, he gets in trouble because he is trying to leave one of his other children with a nurse while he goes into the C-section. There has been an interpreter accompanying some of these appointments and trying to work through this. After the twins are born, at least one of them is a boy, and the father says to the clinicians, to the providers, that he should be circumcised because 90% of Chinese males are circumcised. And he wants his wife to ask her male relatives if they're circumcised or not. So that's the case we have right now to think of. What is the interpreter's role at this point? She's in the room. The father is speaking English to the providers. The mother does not know any English, but also does not know any Arabic, and the father doesn't know any Chinese. And the father wants the interpreter to interpret for him and to try to convince the mother that her children should be circumcised. In this case, what happened was that the interpreter, when the husband said 90% of Chinese males are circumcised, she stepped out of her conduit model, her role, and shook her head and said, that's not true. So she was taking a really big step there. She was not just interpreting the words. She could have just interpreted those words to the patient so that the patient knew what the father was saying to the doctors. But she decided to go one step further. In looking at this example, I want to look at what's commonly viewed as the roles of the medical or healthcare interpreter. And this is what's usually involved in when we're training medical interpreters. We have on the bottom the conduit model, which is this converting the message model, which comes from the old-fashioned idea that words go in one box and they come out on the other side in another language. And that's all that's going on. And then we have clarifier, which is already adding a little bit of complexity. As we go up this pyramid, the role gets more complex and the role often is used less often. And we have to be much more careful about it as we go up the pyramid. Clarifier is the idea that the interpreter needs to clarify the message, the source message, before she can interpret it into the target language. And sometimes it means clarifying for meaning even before that. She might know what it means, but she needs to clarify it in another manner. Then we have culture broker. Again, more complex and even more dangerous. And you have to be trained and really knowledgeable how to work as a cultural broker, because being a cultural broker does not mean, oh, you know, so-and-so, well, all Chinese people are circumcised, or no Chinese people are circumcised. Just having that discussion is not really being a cultural broker. And as the fourth rule that we have to be very careful with, but which all standards of practice talk about and trainers talk about, is the role of the advocate. This is very different than some other interpreting professions. Very, very different. Legal court interpreters have no such thing. The top of the pyramid just gets cut off. And I think cultural broker is often not used either, although I think there is room for it, but we're not talking about that today. And this is where I believe this interpreter was at this moment when she stepped in and shook her head and said, that's not true. But what were some alternatives that she could have done? Excuse me. You know, she could have interpreted just to the patient. Did she have an obligation to interpret between the husband and wife? Did she have a legal obligation to interpret between two people that live together and that should be able to communicate? I think it raises really interesting questions in this case, and thinking about what is her role, what could she have done differently, and the consequences. Okay, so now what I'd like to do is move along to our next poll, which relates to what do you do if you can consult somebody? So, you know, let's say this interpreter that was in there with these people had time to consult somebody. You know, who could she have consulted? So I'd like to know from you who you consult when you actually have time to do this about an ethical dilemma in the field of interpreting. And so I believe you have the options in front of you, and you can also pick multiple options this time, again, because, you know, it might involve going to multiple people.
Okay, we'll give you another 10 seconds or so to think about it and vote. We've got the majority have voted now, so I'll give you another 5, 3, 2, 1. I'm going to close now, and I'll show you the results. 60% say they would go to their manager, 70% a co-worker, colleague, 44% the medical provider, 5% the spouse or friend, someone who's not in the field.
Okay. Thank you, Lucy. So remember that survey that I did online? It was a Survey Monkey. The answers were a little bit different. And again, it was a small pool, as this is a small pool, and we're not arriving at any conclusions. It's just really more out of curiosity. These are the results that I got on that poll. So if there's time to consult with somebody, we had 20, oh, I'm sorry, these aren't the percentages, excuse me. These are not the percentages. These are the number of people, because the percentages are doesn't give us complete, because you can answer multiple. So we had 28 out of 44 say manager. We had 31 out of 44 say coworker, colleague, 10 people said medical provider, and 7 said a spouse or a friend. So actually probably about the same. I'm not a mathematician, but you know, 31 people out of 44 sounds like it could be something like 70%. 28 slightly less than that, which was what we had for managers. And then 10 out of 44 is definitely, that's actually a quarter, so a little over a quarter. And this one we had 44%. And then 7 out of 44 as opposed to 5%. So that's interesting. The other question that I asked in that poll was which codes of ethics do you consult? And these, again, are the numbers, not the percentages. So 43 out of 47 people said the National Council, 28 out of 47 said IMIA, 18 people out of 47 said CHIA, 7 people said ATA, and then we had some others in there too. Now, I do want to mention that this was sent to ATA interpreter and medical division members that are on the listserv, and this was sent to the National Council on Interpreting in Healthcare listserv, which is a very active listserv, and it was sent to the IMIA listserv, which is not nearly as active, and which was down, so they never got it. So we actually have a majority of people answering the question that belong to and are on the listserv of the National Council. But, you know, this was, again, just to kind of look at where it was in terms of those 3 organizations, and even though most of the people that answered it were members of the National Council, they also looked at other codes of ethics, which is very interesting. So now I want to talk a little bit about those 3 and get into a little bit of comparison and contrasting it. I do want to make a disclaimer because some of this can be political, and I am not, I really don't want to get into any political matters in terms of the different associations or one having more importance over the other or one doing something first or one doing something better. I think it's very interesting to look at the codes of ethics and the standards of practice of each of these associations because they each have something to give, and they each have really strong points, and they mostly overlap. They're mostly the same. I attended an ATA presentation years ago, and part of it was looking at this. Of course, I couldn't find my notes that I took during that presentation, but at any rate, you know, I remember the presenter saying, you know, they're pretty much the same. Some things are called differently. There's a lot more detail in some areas in some of them and not so much in the other. So we're going to kind of look at that today, and that's part of the handouts is that you can look at it yourself as well. The handout that's called the comparison is really just listing the 3 codes of ethic, which are different from the standards of practice, but are very related to them. And then I have that table, which I'm going to present, which is also on that handout. And then you can look at them, of course, yourself, and that's what a lot of the handouts are. The National Council has a standalone code of ethics and a standalone standards of practice. They're directly connected, and the standards of practice has the the related ethical principle with each standard that it presents. There are 9 standards. The IMIA also has a standalone code of ethics and a standalone standards of practice, and their standards of practice can be used as an evaluation tool because it has a rating scale. It's split into 3 areas, which I think is an interesting approach. It also is the one that has the most, I'm calling it personnel issues, by which I mean it talks about whether the interpreter should document their encounter, whether the interpreter should make reminder calls to the patient, whether the interpreter should reschedule appointments for the patient, which, you know, could be seen as personnel or procedural issues that really have to do with the employer. So in other words, you know, what does a contract interpreter do if they're supposed to reschedule an appointment? And the CHIA, the California Healthcare Interpreters Association, and the IMIA, it's 27 points, you know, that they have. So it's a lot. And in each point then is broken down further, and then you can rate them. So it's a very, very long, comprehensive document, which is you know, quite extensive. And then CHIA, they have 6 of them. They have 1 document. And so the whole document is called, you know, the California Standards for Healthcare Interpreters, Ethical Principles, Protocols, and Guidance on Roles and Intervention. So that's 1 document, and then you can pull out from there what are the code of ethics and then the standards of practice. And the interesting thing about CHIA is that they have whole sections on what are the interpreter's roles and then how to make an ethical decision. And that's what we're going to look at today. We're going to look at their model, which is based on you know, amalgamation of ethical decision-making models that are out there. There's many of them with cute acronyms, PLUS, Resolved, other things like this. And then, you know, but CHIA has one that goes through it, so that's what we're going to do. I think, you know, so each of them does present interesting solutions and things to think about. And, you know, we all have them somewhere, hopefully at least on our desktop or, you know, sitting on the shelf somewhere, but we don't always look at them as much unless you're really training somebody. But it's worth going through them. So I went through them in terms of the codes of ethics. So not the standards of practice, but the codes of ethics, which really are seen as something that's prescribing more than just recommending. And this is what I found. And this table is in one of your handouts, so I don't want to go over it too long because I already see that I have 20 minutes left. But, and again, this is not meant to say what's lacking or not. I think it's very interesting. Most of them have all of them. The IMIA, of course, talks about respect in their standards of practice, but in the actual code of ethics, I didn't see anything that could be kind of translated into that term or that concept. The same thing with role boundaries. I did not see it. And Chia, I didn't see anything about professional development or role boundaries. And what I mean really is in terms of the statement about what the code of ethics are. Like what are the points? You know, accuracy, confidentiality, and then there's three things that the IMIA one has that I don't see in the other two, which are communication flow, and so the specific thing in the Code of Ethics, for example, is that you will interpreters will use skillful, unobtrusive interventions so as not to interfere with the flow of communication in a triadic medical setting. So of course this is in the standards of practice of the other two, but not in their codes of ethics specifically. And then there's also a specific thing about not interpreting for non-healthcare interpreting appointments and accepting gifts. So there's a specific item, it's item 12, interpreters will refrain from using their position to gain favors from clients. Again, that's included in the other ones in the standards of practice, but not rolled in specifically, just bringing it out so specifically. So what I'd like to do is go through those in relation to another case scenario. This case scenario, we have a bilingual male who's unconscious, cannot speak, cannot make any decisions. He has severe trauma. He's in the ICU. His wife is bilingual. She speaks English and Spanish. She's very active. His family's coming in, some of whom do not speak any English. They're coming in from other countries. And he's very well known to the staff, the staff at the hospital, and known to interpreters, as in has worked with interpreters. So what's going on here? What are the ethical principles, and what should the hospital do? Who should interpret in this case? Should we let the family interpret? Should the staff interpret? But they know him, and they know the wife. Should we get an interpreter from somewhere else? Can we get an interpreter from somewhere else that's equally trained, that can abide by confidentiality, and that doesn't know this person who's unconscious in the ICU? Because in this case that happened, all of those actually happened. So even an outside interpreter knew this young man that was in the ICU. Very complicated case. And you know, he was looking at long-term care, probably needing some kind of home care for the rest of his life. That's how severe it was, a head trauma. And so the family was negotiating, the family meaning the wife and then the parents, negotiating what they're going to do to care for this person once he's hopefully released from the hospital if he doesn't die. I'm going to go through this pretty quickly because we have another case and I do want you guys to be able to work on it. But I kind of ruled out from those 12 that we saw what wouldn't be involved. I don't think professional development, cultural awareness, communication flow, non-healthcare interpreting or accepting gifts is really involved. But I think in all of those we have to really think about accuracy, you know, who's going to be more accurate, how do we think about you know, that. What is the obligation of the hospital to provide an interpreter between the family of the patient's not even involved? Confidentiality, so there are issues of that. We have respecting the patient, respecting what his wishes might have been, professionalism, role boundaries. We had an issue there with, with the interpreters actually going into the ICU without going through the regular procedures as interpreters. So they were there even though they weren't called to go interpret because they knew the person that was in the ICU. So we had a lot of role boundaries in that sense. Of course, the family has role boundaries as the staff does, and then even an outside interpreter. And impartiality rolled right into that. How to be impartial between this and advocacy, because who's going to speak for the patient and how? Because the decisions are really being made about his life and care when he can't speak. So let's look a little bit about the decision-making model that Chia provides for us, because I think it can really help, and is the kind of thing that if you work through ahead of time with a problem, I think it helps to prepare when the next one comes up. And this is something that I've done with our interpreters here. So we've worked through, with plenty of time with this model, and then when something does come up, you might have that kind of in the background somewhere, and so you can make a decision a little bit more quickly. So you ask questions, is there a problem? What is the problem, and what are the ethical principles that apply? You need to clarify what your personal values are and how they relate to it. You need to consider the alternative actions, so the benefits and the risks. That's an analysis, pros and cons of all the different options. Then you decide to carry it out, you do it, and then you evaluate it. Because as always with interpreters and translators, there's always continuing education. You're always learning, and you go back. So especially with interpreters, but translators can do the same. I interpreted it one way today, or I did X today. Maybe that wasn't really the best thing. So let me fix that as much as I can, and then next time, what am I going to do? And the same is for an ethical dilemma. You evaluate what you did, and then you think about what could I do better. So this is the case that you guys are going to get to respond to, and think a little bit about what you would do in this case. And let's try to follow we're gonna go through the Chia model, and then I'm gonna give you the opportunity to answer. It is not open answer, of course, because it's with as many of you that are on, we really want to do just a poll with set answers. But I'll present options to you, which I think is a little bit limited, but I think it's also very interesting, and hopefully those are all the options that you see as being available. So we have a pregnant patient who tells the interpreter, the in-staff interpreter, that she wants to terminate her pregnancy. She has many children, and she has a lot going on. There's many reasons, but she's decided this is what she wants to do. So she asked the female in-house interpreter, so a staff interpreter, where she can do this. So that's already to be a dilemma. It could be a dilemma for an interpreter. Well, another wrinkle is that the local Planned Parenthood, which most of you should know, that is one thing that's done at Planned Parenthood is abortions, terminating a pregnancy. They do not provide interpreters for this language pair. Legally speaking, do they take Medicare and Medicaid to perform the abortions? Because if they do not, if they don't have any federal funding, but of course they do have federal funding, but if they don't have any federal funding, they don't even have to provide interpreters. So there's already kind of a legal issue as to whether Planned Parenthood has to provide an interpreter or not. But in this case, the local Planned Parenthood was not doing that, and the staff interpreter knew this. So she's presented with this question, what does she do? Does she leave the patient on the hook, fend for yourself? Does she provide her with some information? Does she go interpret for her? The Planned Parenthood has nothing to do with her job. Her job is at a hospital that's not Planned Parenthood. And the hospital does not do this type of abortion, because it's what's called an elective abortion. So let's go through the model, the decision-making model. Is there a problem? So what are the questions? Will she seek an abortion some other way? In that, will she do harm to herself? Okay, she could. Can she go to Planned Parenthood without an interpreter? So can she do this without an interpreter? Can they gesture themselves away? I don't know. Is it against employer policy to go? So in other words, the staff interpreter, can she do this on her own? Would the patient seek help afterward if no interpreter is provided for procedure? So something goes wrong, Is she going to look for help? Is she going to know where to go? Is she going to know what's a problem if nobody's even told her what the risks are? Who is going to pay the interpreter? Is anybody going to pay the interpreter? Of course, we don't charge the patient. Planned Parenthood doesn't provide them, so this will probably be a volunteer job. Should Planned Parenthood provide the interpreter to begin with? And is it the interpreter's obligation to tell Planned Parenthood they should? And is the patient part of the same religious community as the interpreter? They could be Christian, they could be Muslim, they could be Buddhist, they could be a variety of things. And so these are some of the questions. There's probably a lot more. The problem that we're stating, the ethical problem that we state, that's the next step. Interpreter does not know whether she should accompany the patient to Planned Parenthood. This is what the patient wants to do. The interpreter doesn't know if she should do that. There's issues of patient autonomy, giving the patient the choice of what they want to do. Impartiality, because if the interpreter doesn't agree with it. Advocacy, because of harm to self and her rights. Living in the country, you have a right to seek an abortion. And role boundaries. What are her roles here? Because she's not employed by Planned Parenthood, she's an interpreter for another type of appointment for this, but now we're getting into issues that are more complicated. She has to look at her personal values. That's the third step. So does it matter what that interpreter would do herself if she was in that situation? Has she ever been pregnant? Has she lost children? Has she terminated a pregnancy? All these things are going to feed into it, and the interpreter has to ask herself that. How can church or family help, or organizations that are pro-life or that are trying to get people from preventing doing abortions? So start thinking about this, because you're going to have to give me an answer for this of what you would do. These are the alternatives that you're going to have. Okay, because now remember we went through the 3 steps. Okay, so is there a problem? What is the problem? And what are my personal values? And then now we have to look at let's decide and take action. So I want you guys to decide and take action. And I'm going to read first what the options are, okay, and then we'll run the poll. So bear with me. If you have 3 options, you can only pick one. Well, there's going to be 3 questions, but of those 3 questions, you're only going to answer one of them. Okay, so they're going to be on different screens, because these are you can't answer 1A and then answer 2A. Because 3 is actually doing that. So you can decide something about to do with Planned Parenthood. So you're going to provide the patient, you're the interpreter, you're going to provide the patient with the Planned Parenthood phone number, and then you have the option of interpreting, of telling the organization to find the interpreter, finding another interpreter yourself, or walking away. In other words, not giving her the Planned Parenthood phone number, but just leaving it at that. The other option you have, so if that's the only thing you want to do, one of those 4 within the first one, that's all you can answer. Then the second thing you can do is you provide the patient with the number for pro-life support. So there's official pro-life support groups, some of them more convincing than others. Some, you might have your own opinion about what that is. Church, there's different resources. And then you can pick the same alternative. So you would give the number, and then you could interpret. You could tell them to find an interpreter. You could find another interpreter yourself, or you could walk away from it. Just give her that number and wash your hands of it. The third option that you have is if you don't go with just 1 or just 2, you want to go with kind of a combination of them. So then you're going to answer the third question that we're going to post. So you provide the patient with numbers for both types of organizations. Okay, so you're giving her both. And then you interpret for both, or you interpret just for one, but not the other. You arrange for somebody else to interpret for both, or you walk away. Okay, I know this is a lot of options. I hope it's clear. So we're going to run the poll, and I'll kind of walk you through it again. So remember, if you answer the first one, if you want to answer 3, don't answer 1 or 2. If you want to answer 2, don't answer 3 or 1. If you want to answer 3, just wait for it to come up.
Okay.
So not everybody's going to answer it. Okay.
The poll's open, so as Elena said, only answer this poll if this is what you would do. So I'll give you another 5 seconds, because obviously it's not everybody's going to be voting on this one. And 3, 2, 1. Closing the poll. And I'll show you the results. 11% of those who voted, this is not of everybody who's here, 11% of those who voted would interpret, 56% would tell the organisation to find an interpreter, and 33% would walk away.
I'm sorry, could you repeat that, Lucy? It was 11% for the
11% would interpret, 56% tell the organisation to find an interpreter. Nobody said anything about finding another interpreter, and 33% would walk away. Okay, but that's quite low numbers. Only 10% of people here present voted. Okay?
Okay.
Right, we'll go on with the next one. Launch that one.
So again, the next one you would only answer if that's all you want to do. You did not answer 1 and you're not going to answer 3.
Okay. Although the poll's open, nobody seems to be voting here at all. So it's not an option that people are going for, Elena. I'll give you another 5 seconds in case. 5, 4, 3, 2, 1. Okay. Oh, somebody did vote just at the very end.
Okay. Okay.
4%, which I think probably means 2 people. One went for interpreting, and the other one went for telling the organisation to find an interpreter. Okay.
Okay.
And here we go with the third one.
So this is the one where you can do both, and you can do both fully, or you can do both or halfway.
The options are slightly different. Option number 3 here is slightly different.
Yes. So one you would interpret for both of the organizations. The second one you would interpret for one but not the other, but you're still giving them the number for the other one. The third is you arrange for somebody else to interpret. And the fourth is walk away. And now all of these, of course, are provided that you've worked through this with somebody else, you've gone to your manager, you've gone, to social work or somebody that would handle that. You're not doing this necessarily isolated by yourself.
Okay, I'll close the poll now. Give you another few seconds. 3, 2, 1. So now's the time. I'm closing. And I'll show you the results. We have 50% of the people here at the webinar voted. 24% of those would interpret for both organizations. 8% would interpret for one but not the other. 20% would interpret for neither but would arrange for it. And 48% would just walk away. Have you got those numbers, Helena?
Interesting. Interesting. I think I do. Yeah. Yep. So 48% of that last one would provide the numbers, but not interpret.
And then walk away. Yeah.
Yeah. Walk away, and allow for the organization to hopefully find something, or for the patient perhaps to speak for herself, and tell the organizations to find somebody. And then in the first one, we had a majority doing. Giving the number and telling the organization to find the interpreter. Is that correct?
Yeah, we had 56%.
56.
Would tell the organization to find an interpreter, and 11% would interpret, and 33% would walk away.
Okay. And then it looks like we only had 64% of people responding.
Not everybody responded, yeah.
Not everybody responded. Okay. Okay. Well, thank you for that. I think it's it's interesting. It's a little bit hard to present such a complex thing with these given answers, and I'm hoping that that's why we didn't have participation or wasn't quite enough time. But it's really interesting, I think, to look at those results because the walking away option is interesting because you're kind of providing some advocacy by giving her the phone numbers, especially for both types of organizations. So you're saying, look, here's the organization that will help you terminate your pregnancy if you want, and if you go through, they have a whole system where you learn about the risks and the benefits. And here's an organization that's going to help you, to keep your baby, provide you with the support to not have an abortion. But I don't want to be the person interpreting, and I'm not going to arrange for somebody else. I'm just going to hope that it works out. So that, I think those are really interesting responses, and perhaps we could in the future we could open it up for more discussion about just about that, really what people are choosing. And the other one where you provide it just with the Planned Parenthood, most people would tell the organization to find the interpreter. So it sounds like a lot of people are very uncomfortable doing this, and have decided through the decision-making process that they don't really want to be involved with this. We do have some people that do want to interpret, but 24% of 50% of 60 people. So again, I can't do the math that quickly, but it's, there are some people doing it, but there are a lot of people that are saying, I don't want to be put in that position, but I'm going to help out in some way, either all the way or at least setting her up with those numbers. Well, in conclusion, and I think really looking at that poll, it is complicated, but it's not impossible to make these decisions, and it's necessary, and we have to do them. And then we have to evaluate afterwards, was that the right thing? Was that the best thing? How can I proceed next time something comes up, something like this or something different? It really should be case by case. We have to look at this. What is the whole context? Who am I? Who is directing this? What are the rules? What is my employer going to say? What is the law going to say? And remembering that you're not alone. You're not like La Malinche that's forced into this and that has no guidance, orientation. You can seek help from people. You can seek advice in the standards of practice, in the codes of ethics, and among your colleagues and your superiors. And I hope that this presentation has at least started to get your mind going in terms of how to make principled decisions that are based on the professional guidelines and the context, and doing this each and every time. And with that, I conclude.
Thank you, Elena. We'll start with some questions now. Shall I start, and then Naomi, and then Mary take a question, yeah? Marcella is asking, is one of the SOPs not being a cultural broker, would you say?
No, they all have that in there in terms of the standards of practice. So there's sometimes it's called cultural awareness, but the standards of practice all talk about that.
Okay. Another question, Naomi. Are you going to read this one, or shall I do it again?
I can read it.
Yeah. Okay. Yeah.
Okay. So one person, Radosvelta, asks, is this merely an interpreter role at all? Isn't it more correct to inform medical personnel about the patient's request?
Okay, so I'm going to assume the question was probably in response to the last one, and definitely that's the idea of not working by yourself. So oftentimes when something like this arises, this is something that the interpreter has time to think about. So so does the interpreter give that number? I guess when I gave that answer, providing the number, it's really providing the number with somebody else, and I'm sorry if that wasn't clear, but it really should be just the fact that the interpreter is left with that in her lap. She could go further with this or not. She could tell the patient, this isn't my business, but she could seek a social worker who would then go through these options with the interpreter. But usually, if the interpreter is requesting just to terminate the pregnancy, that would probably be the options that would be spoken about. Oftentimes, they would not speak about going to your church or to seek a pro-life organization necessarily. So it's something that the interpreter would then be faced with, although I'd mentioned that as well.
Okay, we have a question from Mary Jane. Actually, I'm going to combine two questions here. She thought that an option in the number 3 situation would be missing. I think I would give the numbers but not arrange for it, even if I thought of this, but I would assume the patient might have a friend who could help arrange for it. And then earlier we had a question from Carol who says why family members are not supposed to interpret, and I kind of see these as two, a combined question for you.
Okay, okay, that is a great question. In terms of family members interpreting, this is a really big thing that I face as a supervisor, because we do have interpreters actually that are employed as interpreters whose family members come to the hospital, and so then we're confronted with that question. Most of the time, they're not even trained interpreters, and we get it a lot. So the interpreter shows up, and there's a family member there. And there's a lot of problems with that, and the standards of practice address all that, and really say that the interpreter that family members should refrain from interpreting. So of course the standards of practice are for us as professionals, but the hospital administrators that make these decisions make the decision that family and friends should only really interpret in the case of an emergency, or if the patient is refusing an interpreter. It's a matter of impartiality. So can they really be impartial and say everything that the patient and the provider are saying without interfering and filtering? Do they know all the medical terminology? Do they, if they don't know something, what do they do with it? Family and friends are much more likely to put it under the rug, brush it under the rug, and then not deal with it. Whereas a professional doesn't know the term, they're not going to just forget it. They're going to ask clarification or something like that. Family members are also often struggling with receiving news about their family or friend's health, and then they also, on top of that, have to interpret it. So, what if if the diagnosis is cancer? What if they don't want to tell their mother that she has cancer because they think her mother should know that she has cancer? That's a really big problem, really big problem. There's all kinds of issues with family and friends, so that's strongly, strongly discouraged, and it really should only be done if it's an emergency, there's absolutely nobody else, and the person's having a heart attack, and there's important information that needs to be gotten, and not only if they're an adult, because if they're a minor, it's absolutely legal to do. A child cannot do it by law. The Department of Public Health and the Office of Minority Health and the Department of Health and Human Services all, and also the Joint Commission, which regulates hospitals, not clinics, but hospitals, says the same thing. It should be a trained professional that's been screened for their language and trained as an interpreter.
Okay. Mary, how many more questions would you like to take? We're running over
two.
A couple. Okay, I'll do one, you do the other, then I'll hand over to you.
Sure.
Marcella and in fact another person, Maria, were asking if we could quickly review the differences between cultural broker, advocate, and communicator, the role of the interpreter there.
Okay, sure. So, and I'm sorry that I kind of went through that apparently too quickly. It's hard to know, where people are at in terms of how much they know of this. So I guess I thought that was a little more universally known. The role of there's the conduit model, or the conduit role, right, which is at the bottom of the pyramid, which is really just the idea of interpreting the message, converting the message. But then we have clarifier, which is the next one, which I think is probably what you refer to as communicator, which is you have to clarify that message in order to communicate it. So in other words, you think that the patient isn't going to know what endoscopy is. Okay, you're not sure. You're looking at their cues, or culturally speaking, they're not going to know this, or there's just something in there that you're kind of getting an idea that this person doesn't understand endoscopy. So that's when you could clarify with the provider what they mean by that. Or you don't know what endoscopy means, and you want to make sure, so that when you interpret it, because some languages like Somali don't have one word, so they actually just explain it. And there are others as well. So then you have to, make sure you're giving the right explanation. Endoscopy could actually be from up or down. It's not necessarily just through the throat. Sometimes they can go up the other side of us. So you don't want to say it's through the throat if they're going to do an endoscopy the other way around. That's going to be very, very bad for the patient in terms of the differences. Then the cultural broker, or cultural awareness, or cultural responsiveness, those are the other two ways that these are talked about in the standards of practice, is really ensuring that everything is conveyed to the patient, taking culture into account. So sometimes, like with mental status exams, they ask those questions about who is the American president, and you know that this person who's coming from a rural community in Mexico does not know who Obama is. and they really shouldn't have to know that. So that in that situation, this is a very particular thing to medical interpreting. The interpreter has a role there, because if they're doing a mental status examination and this person's deemed as having some kind of mental impairment because they don't know who the president is and they don't know where they are, and they just refer to like the general location and the towns, but they don't know specifically, or they don't, you know, that's, or maybe they don't remember their birthday, but in their culture, birthdays really aren't as important as they are here, and people actually don't know when they were born, or they were a refugee when they were born, their parents were refugees when they were born, and nobody even knows when they were born. So that's what a cultural broker or awareness or responsiveness is. It really is responding to problems that are going on with communication because of culture, and having the obligation to respond to those. And then finally, advocate is a role that if harm is going to be done to the patient or to someone else, it's very similar to the mandated reporting, you know, for therapists and for other staff, where there's a confidentiality, but you can break it if the person says they're going to kill themselves, or they say they're about to kill somebody else. Or if you think that there's discrimination going on and you think it's a pattern, you can actually act as the advocate. Or you know that this. You think, not, maybe you don't know, but you think that this person doesn't really know that there are financial counselors available, so they don't have health insurance and they don't know where to start. Well, an interpreter that's just interpreting what's going on in that session isn't going to be able to talk about a financial counselor. But an advocate interpreter might say after the session, the hospital has financial counselors and I can help you arrange an appointment to see a financial counselor. That's an advocate. But there's room for that for medical interpreters, which is very interesting if you compare, very interesting when you compare it to other specialties. And it's legal is the big one to compare it to, but what they say about medical interpreters is that everybody wants the patient to get well. We all have one goal. Whereas in legal interpreting, there's competing goals. You know, not everybody wants the guy to go free. So, but in simplistic terms, everybody wants the patient to get better.
Okay, one final question. If you were going to do one of the Planned Parenthood options in the termination of pregnancy, would you need to ask your supervisor if you can volunteer?
You know, I put this up because we did have an interpreter that came in and asked me about this. So she did bring the problem to me. And, you know, I talked with her about what she wanted and, you know, where she was on that, and then she made the decision. But I think it's an interesting question. I don't think there is an obligation to go to your supervisor if Planned Parenthood is not within, you know, it's not your employer. So the patient's coming to you otherwise. But you could seek the help of a social worker that works for that hospital, because she's a patient of that hospital, and might be a patient if she does something and takes some medication and botches it and loses, miscarries or something, then she'll end up there anyway. I would highly recommend seeking, yes, help from your supervisor in that case. And I guess that was the last question. I'm sorry that we went over, and I do, this is really good for me to learn in terms of going over those roles, because I probably should have spent a little more time on that.
Okay, I want to thank you for offering us the webinar. I've already had several comments commending you on your presentation, so it's always nice to hear that, right?
Yes, thank you.
I wanted to discuss or offer you a few of the upcoming ATA webinars. Coming up in September, tips for navigating your first ATA annual conference. Our conference is coming up in Boston, October 26th to October 29th, for any of you who don't already know. And it can really be very overwhelming. I was overwhelmed the first time I worked at a conference. So please consider attending this webinar. It is free and registration is open. Next, we have part 2 of the webinar that we had last week. This one, again, is working with PDF files, and it's primarily about converting the files. So if you heard Tuomas last week, I know you'll want to attend this one, and if you didn't, then I think you might give it a try. And finally, this is one we just added to the schedule. healthcare interpreter certification. National certification is really here, and you need to consider, is this something for you, or is it just a lot of talk that you don't need? So that's a good webinar, October 13th, again 12 noon. And finally, I want to remind everyone again about the conference, and here's my little to-do list. First, check out the program online. It's all there, speakers, bios, abstracts. Then register by September 23rd for the best price. That's when the early registration discount ends. And book your hotel room at the Boston Marriott. I understand the rooms are filling up really quickly. And finally, get your business cards ready for the job marketplace. You don't want to be trying to do that at the last minute. The business offices and hotels are typically not the ones you want to handle your business cards. Learn more about Boston before you go. The members of the New England Translators Association have a blog, and they're giving you all the little-known spots in Boston. So take a look for it. You can go directly to their website, nitaweb.org, or you can go to the ATA Annual Conference website and click the Boston tab, and you'll find it there. Finally, I want to remind everyone that ATA Staff Headquarters is ready to help you. Please give us a call. You can see the number at the bottom, 1-703-683-6100, or you can email ata-hq@atanet.org. And with that, I'll thank you once again, and I'll close the webinar. Have a great day, guys.